Hello, my name is Jordan Bedford, and this is my presentation on a research proposal involving auditory hallucinations, inner monologues, and mindfulness. The 1990 study, Subvocal Activity and Auditory Hallucinations, Clues for Behavioral Treatment. The rationale was to look at a more empirical study with a more significant sample size, as well as very defined diagnostic measures. They were looking at two distinct hypotheses. One, that auditory hallucinations could be associated with the subvocal activity and that it would be reflected in electromyographic activity. And they did this through self-reporting of the participants of their auditory hallucinations. And also, they were hypothesizing that behavioral techniques, which were the conditions, would interfere with subvocal activity, and that could reduce the auditory hallucinations, and that they would not be affected by any controls. So this was an empirical study involving 20 individuals, 80% male, the mean age of 33 years. And these were all individuals diagnosed with schizophrenia. They were subjected to 5 different conditions: holding their mouth open, biting the tip of their tongue, quietly humming a singular note, making a fist, and raising their eyebrows. The last two, making the fist and raising the eyebrows, were considered the control conditions. The individuals were also supposed to push a button that determined the longevity of their hallucination. This was counted in seconds and served as the dependent variable for the condition. So if the different condition, if it had any, where it reduced the longevity, the duration of the auditory hallucination. The individuals were in a soundproof room, their baseline EMGs were taken, and they were shown cards to let them know which condition they were to participate in. The electrodes were on their lips and I believe their throats to get the EMGs to see if that subvocal interference played a part in shortening their auditory hallucinations. The study looked at 3 key questions, one being, are hallucinations associated with increased EMG activity? The F values were not significant. There was also a question, do the conditions affect the self-report of hallucinations? The one condition that did was the humming, and significantly reduced the self-report hallucination in comparison to the baseline. And for the conditions affecting EMG recordings, they corrected for comparisons, and there really wasn't much significance that remained after that correction. The study showed that there's not only substantial treatment potential, but there's a lot of challenging complexities to aiding and reducing auditory hallucinations, but what was significant was just the humming of the singular note reduced the duration by nearly 60% for the duration of the auditory hallucinations in these schizophrenia patients. My current study aims to look at the use of mindfulness as a treatment in the mitigation of auditory hallucinations, intrusive thinking, or simply loud verbal thoughts. Mindfulness is a practice used as a therapeutic for anxiety and individuals suffering from stress disorders. It's the practice of focusing in the present moment and how one senses in and around their own body. A lot of these focus on breathing and breath. And I want to look to see if there's any empirical evidence that simply participating in these can kind of give a sense of control to the individual experiencing these intrusive thoughts, auditory hallucinations, or just simply a loud verbal monologue, and could maybe help mitigate some of the stress that goes along with experiencing that experience. The previous study mentioned before took a look at how subvocal interference, so actually producing those sounds or messing with the mouth, can reduce the duration of the auditory hallucinations. But I want to look at how focusing inward could potentially also increase the intensity or reduce the duration of those hallucinations in psychosis patients, as well as in individuals who just simply have complaints of loud thoughts in their head or a loud voice in their head that is more times than not simply their own. My hypothesis is that the daily use of mindfulness meditation will lessen the intensity and duration of overwhelming verbal thoughts and auditory hallucinations. Participants would be recruited through a behavioral health facility with the aid of their therapist. This would be both inpatient and outpatient individuals with complaints of auditory hallucinations or loud verbal thoughts. It will be a repeated measures ANOVA. Individuals would be asked to keep diaries and complete daily questionnaires for 28 days. And participants would come two groups. There would be the individuals who have been diagnosed with with a form of psychosis, and those who do not but simply have kind of the intrusive loud thoughts. From there, those two groups would further be divided randomly. One group receiving standard talk therapy. One group would be instructed to only participate in the mindfulness meditations during a auditory hallucination, and the third group would be asked to participate in mindfulness meditations every single day for the duration of 20 minutes. So the analysis would be repeated measures ANOVA, and implications, if the hypothesis is correct, would be providing patients with a sense of control over themselves and their diagnosis, as well as providing an additional tool and coping mechanism, especially for individuals who may not want to take medication. I know a lot of individuals who are really against it. Some are normal, and it's getting better with the destigmatization of mental health. People are more willing and accepting of medication, but this would just be one more tool in that toolbox to help individuals experiencing these hallucinations or those overwhelming thoughts to better be able to control themselves and have control of their lives and just give them a sense of freedom.